Hello everyone. I will be focusing on emotional abuse faced by female doctors in healthcare settings. Yes, even doctors face emotional abuse because when they decide to go on maternity leave, their colleagues, the male doctors, are unhappy about it because of the pressure. There's already a physician shortage, and then these ones want to go on leave. Unfortunately, they're entitled to leave. But as healthcare leaders, how do we ensure that our staff are not facing any form of emotional abuse and everyone is aware of what maternity leave means and breastfeeding and breast pumping for both the mother and the infant? There's been a lot of violence in the society. However, in workplace, gender-based violence also exists. So therefore, I will be focusing on Chapter 8 of the book, Keys to Successful Leadership in Healthcare Settings. Chapter 8, Deciding Duration of Leave for Physician Mothers. Physicians spend a lot of time training to be professionals. However, there are women among them who, like other women, decide to have children. When the time comes to take maternity leave, there are conflicts faced in the workplace regarding the duration of leave to meet work demands. By returning early from the leave, and this may negatively affect the health of both the mother and child. Strang and Miriam, 2016. Keller et al. 2018 described the challenges that female Air Force officers face in their careers, which affect how they get promoted to senior ranks, and childbirth came up as one of the major setbacks to become senior officers. This chapter will explore the health benefits of parental leave and conflicts arising in the workplace regarding parental leave. Recommendations for healthcare organizations to ensure that workplace conflicts surrounding parental leave have also been provided in this chapter. Case study: Physician mothers and conflicts with maternity leave. Jones, Royston, Hung, and Wright, 2019, published the results of emotional/personal and intergroup conflicts that arise in the workplace concerning maternity leave and the preparedness for work after childbirth by physician mothers. The survey involved 844 physician mothers over a 4-month period based on their experiences with the first child after medical school. 59.7% had positive reports for emotional support from colleagues. However, there were more negative reports in the study, which included insufficient leave time as the majority, 89%, preferred 11 weeks to 6 months at maternity leave against the current 5 to 12 weeks maternity leave, which is usually unpaid. Some of them had inadequate childcare, 35.3% of them. 18% of them faced discrimination at work, and lack of time for the infant was faced by 48.2%, while lack of facility for breastfeeding or breast pumping was faced by 32.2%. Now that we know that a lot of issues arise, what are the specific workplace conflicts related to parental leave faced by physician mothers? Various types of conflicts exist in the workplace. While different industries experience similar disputes, the healthcare industry commonly experiences these 3 kinds of conflicts: intergroup, interpersonal, and constructive conflicts. Fallon, Began, and Riley, 2013. Intergroup conflicts. Physicians are elite and can be categorized as conservative group in the workplace. According to the study by Masters et al. 2017 on the working conditions of Americans, women are more likely than men to report difficulty arranging for time off during work hours to take care of personal or family matters. The study further revealed that female workers earn lower than their male counterparts despite educational qualifications, which was more evident among younger and prime age women. Masters et al. 2017. For example, In the U.S. Air Force, female officers are found to retire early or do not attain high levels of seniority due to childbirth and maternity leave. Keller et al., 2018. This kind of difficulties experienced by educated women brings about workplace conflicts regarding the duration of maternity leave and promotion to senior roles. Emotional or personal conflicts. Discrimination is a form of emotional abuse that happens in the workplace, and physician mothers, as described in the case study above, suffer from it as well. Jones, Royston, Hong and Wright, 2019. Women have been reported to have more good friends at work when compared to their male counterparts. However, the males get more support from their bosses. Masters et al., 2017. As physician mothers have to breastfeed or breast pump during office hours, it is less likely they will complete their task in the same time frame as their colleagues, resulting in a lack of support from their bosses. What are the constructive conflicts in deciding duration of maternity leave? Strang and Miriam, 2016, have provided the negative and positive effects of increasing the maternity leave period. While it may be a health benefit for both the parent and the child by ensuring breastfeeding occurs for more extended periods, it is a form of setback for the employers when new staff needs to be hired as maternity cover each time a maternity leave is granted. Women are already facing delays with progression to senior roles, and the addition of maternity leave further prevents them from being hired by organizations. With physicians, this may not be the case as there is a shortage of physicians in the US, even globally, which ensures that both males and females have an opportunity of being employed or returning to their jobs after the stipulated company maternity leave. In the US Air Force, maternity leave was increased to 12 weeks with payment, while tests for fitness and readiness for job were delayed to 1 year postpartum. Keller et al., 2018. This ensured that eligible female officers were made to stay in reserve, with payment for up to 3 years before they are ready to work fully. The limitation of this is that there will be more childbirths and maternity leave by female officers, further reducing their progression to senior ranks when they spend too much time in reserve. However, there will be more female officers in the force overall due to consideration for maternity leave. My recommendations for parental leave in healthcare educations. Studies on the conflicts arising from maternity leave in the U.S. Air Force, Keller et al., 2018, European Union, Bell et al., Strang and Miriam, and of physician mothers in the U.S., Jones, Royst, Hung and Wright, 2019, have provided reasons for workplace conflicts as well as recommendations to improve the working conditions of professional women during childbearing years. I would just pick the points so that I'm not reading the whole of the book. My first recommendation is that there should be daycare centers for children of staff and facilities for breastfeeding and breast pumping within the workplace. This will promote early return to work of physician mothers. 2. Parental leave should be permitted for physicians to ensure the health and development of children, as children that are unhealthy end up in hospitals for treatment. The third one is that when employing staff, their parental status as well as their intention to have children should always be confirmed and accommodations made to ensure employee engagement at work. The fourth is that the European Union has 18 out of 28 countries, that was before the withdrawal of the UK, that provide paternity leave of an average duration of 12.5 days with full payment to speed up return to work of nursing mothers. Sharing parental responsibilities in the family has proven to be beneficial to the health and development of the newborn. If healthcare organizations in the US adopt this method, more physicians will be available as the number of females graduating from medical school is increasing, meaning more maternity leaves will be requested. Jones, Royce, Huang, and Wright, 2019. In addition, shared parental responsibility implies that physician mothers can return to work quicker when their male spouses take paternity leave to look after the children. However, fewer physicians will be available if the specialty is a male-dominated field and paid or unpaid leave is granted to physician fathers. In summary, This chapter has provided a case study that explains the current conflicts that female physicians have in their workplace after childbirth. The recommendations described by the U.S. Air Force on ensuring women get to senior ranks provide a better way to treat female physicians who need more time to look after their infants. Thank you, and you can get a copy of this book, either paperback or ebook, at Lulu bookstores, also available at Amazon and over 10,000 retailers. Thank you very much for listening to me.